Om Shanti and welcome to Ek Mulakat. As you may know, we bring a special guest to you each time on this show. Our special guest today is Dr. Satbir Singh Khalsa. Dr. Khalsa is a researcher in the field of mind-body medicine, and his emphasis is on yoga therapy. He's an assistant professor of medicine at Harvard Medical School and an associate neuroscientist at BWH, Boston, Massachusetts. Dr. Khalsa, we'd like to welcome you to this show, Ek Mulakat, and also to the Godlywood studio here in Mount Abu. Dr. Khalsa, as I understand, you're a researcher, and your emphasis is on mind-body medicine, mind-body health. The emphasis is on health in terms of Kundalini Yoga. So you've been using Kundalini Yoga for therapy. There are different practices of yoga. As we know, there is Kriya Yoga, there is, of course, Raj Yoga, and there is TM. What was that attracted you about Kundalini Yoga that you chose that for therapy?
Well, I'm actually not a therapist. I'm a researcher.
Okay.
I have had a personal practice of Kundalini Yoga as taught by Yogi Bhajan. Mm-hmm. And that began some 47 years ago. That was, you could say that was divine intervention to some degree, the way any student comes to his teacher, to his spiritual path. And so that's the yoga that I started practicing. And it had great benefit for me. And I got involved with the community that was involved, the ashram that was involved, and I have never left. And since that time, I have taken on a career as a yoga researcher.
Okay. For the benefit of our viewers, could you please explain what Kundalini Yoga is all about?
So Kundalini Yoga is taught by Yogi Bhajan is very similar to other forms of Hatha Yoga. It incorporates basic components of traditional yoga practice, which includes the asanas, physical exercises and postures. It includes a lot of pranayama, breathing techniques. It also includes the deep relaxation, the yoga nidra. And there's a significant emphasis in Kundalini Yoga on meditation practices. Okay. And so Kundalini Yoga is different in style from other forms of Hatha Yoga. Okay. It's much more dynamic in the sense that there's an incorporation of mantra together with breathing, together with asana. Okay. Yogi Bhajan taught many different discrete meditation practices, often involving a breath and a mantra and a mudra at the same time. Most of the physical postures and exercises in Kundalini Yoga are similar to what you see in Hatha Yoga. Okay. But there are some differences.
What exactly is your involvement when it comes to this research?
So I started out conducting clinical trials of yoga interventions for specific conditions. Mm-hmm. So I began with studies looking at the benefits of yoga for chronic insomnia. We moved on to music performance anxiety. Oh, okay. We moved on to post-traumatic stress disorder. That led to studies on generalized anxiety disorder. We've run a clinical trial of yoga for chronic stress. I became very interested in running trials of yoga in school settings for the benefits of children's behavior and mental and physical health. Now, one of the directions we're moving in is bringing yoga into the workplace, into the occupational setting, and looking at the benefits under those conditions. And in the early days, the trials were run in my laboratory, and we ran those trials all the way from A to Z in terms of creating the protocol to running the subjects to analyzing the data, publishing the papers. More recently, I've been involved more as a co-investigator on studies. So the primary studies run in another lab, and I'm on a phone call once a week, and we're collaborating. I'm helping with the paper. I'm co-investigator on that trial. So that is my involvement. It continues to be something that I'm actively involved in ongoing studies.
That's very good to know. You've been traveling all over the world to promote yoga. What kind of response do you get when you go into a community and this is a form of alternative medicine, if I may. Mm-hmm. So people these days are so much into, I'm not sure how well accepted it is. That's really my question. When you go and talk to people or give your talks and lectures, what is the acceptance level?
So the interesting thing about, lecturing on yoga research is that you don't get invited to an audience that's antagonistic against you. You get invited to a group which is either a yoga group or an integrative medicine group. And so generally I would use the phrase that I'm preaching to the choir. These are people who are interested in this area and may know little about it, but are very open to it. And so this, the audiences that I usually speak to are either along the lines of yoga therapists and yoga teachers or yoga practitioners, and on the other end are people who are scientists, clinicians, who are open to the idea of yoga and meditation as clinical interventions. Some of these groups have little knowledge of the research that's been done and the value of the research and what it can do. And so they're very grateful for getting that information, getting the update on, what are the latest trends, what are the latest findings, and then how to speak the language of science, how to understand what we know about how yoga works and how yoga therapy works. And then beyond that, how this fits into modern medicine. How do we bring it into modern medicine? What's its relevance to the rest of the medical system and the medical approaches?
Would you give this therapy in conjunction with the modern medicine? Or if you had a patient, do you give him an option, like you go through this therapy to get better, or you take your medicines, or you do both? I mean, how does that work?
So, I'm not a yoga therapist, but, the way yoga therapists would work would be treating the individual. In modern medicine, there's often a focus that you're treating a disease rather than a person. And in integrative medicine, we try and get away from that. So you're focusing on an individual. That means it's going to be individual care. So you determine, and it depends upon a lot of factors, what you do. In some cases, and this is going to be the minority, you might say, we're going to discontinue your allopathic medicine, or we're going to just give you yoga therapy. And you wouldn't do that with a serious disorder, for example. But if someone had chronic insomnia, which is not life-threatening, you could ask that person to taper off of their medication while you started to do yoga therapy, and that would be safe and appropriate. But for a patient who is on, hypertensive, or a patient who has a serious condition of some kind that the medication is keeping them stable, you would then use yoga as what we call an adjunct therapy. Another example of adjunct therapy is cancer patients. The goal of yoga for cancer patients is not to cure the cancer, although it would be great if that happened. The goal is to provide management of the stress of that diagnosis, management of the symptoms or the side effects of the treatments, the chemotherapy, the radiation therapy, and also a sense of life meaning and purpose. And so that's something that modern medicine doesn't have. There's no drugs for that they can add on to the drugs they're already giving these cancer patients. So yoga has a real niche there. And there's a lot of research now on yoga for cancer patients. So in that sense, it's an adjunct. But with very clear and very powerful positive benefits for the patients.
And, that goes to say about the whole mind-body medicine aspect, where you're treating the patient as a whole and not just a particular disease or affliction that the patient has. Could you talk to us a little bit more about how this treatment is being used for non-communicable diseases like, say, depression and diabetes and, the kinds of NCDs that are prevalent in the society these days?
So these non-communicable diseases are often referred to as lifestyle diseases. They come from either poor behaviors or the inability to cope with life.
When you say poor behavior, could you please expand on that?
Not exercising, not getting physical activity. We're a very sedentary society. That has a lot of very negative health benefits. And then there's clearly aberrant behaviors like smoking cigarettes, excessive alcohol consumption. So there's a number of behaviors that are dysfunctional, that are not healthy. They're really at the cause, at the root of the development of lifestyle diseases. So those are behaviors that need to be changed. And the problem in modern medicine is that behavior change is not strong in modern medicine, the whole idea of applying it. What most allopathic doctors do to try and change behavior is use guilt and fear. Mr. Jones, you have type 2 diabetes. You need to stop eating refined foods. You need to get more exercise, or you're going to die. And that's the approach. In yoga, we are trying to address the issue more holistically. We're trying to change behavior from the bottom up. By increasing their mind-body awareness, they are now becoming more sensitive to their body, which means that they're going to react by avoiding things that make them feel bad, that's the negative behaviors, and adopting those behaviors that feel good, which is like exercise. So it's a bottom-up approach from that perspective. That's different from the top-down approach that modern medicine used to try and instill behavior change in people with lifestyle disease. And stress is a big part of this as well, because one of the paradoxical things about chronic stress is that people respond with dysfunctional negative behaviors. So, you know, the classic tub of ice cream as your stress reducer, which of course that's not helping you. That's not of high nutritive value. That's making things worse. Smoking cigarettes, drinking alcohol to try and get a buzz. That's also dysfunctional, impairing your ability to manage stress. So yoga really works at the true level of really giving you true stress tolerance and stress management strategies at the core of what stress is and how you react to stress.
Right. So would anger management be part of this as well?
Well, you know, anger management is a very specific psychological intervention. And yoga works, I think, at a deeper level. Yoga works at allowing the individual to come to a new relationship to his or her emotional reactivity. And this comes through the meditative practice, and it also comes through the physical practice of reducing the stress hormones, the stress reactivity. As you focus your attention in the act of meditation, you are engaging in a practice that changes your emotional and stress reactivity.
You do your meditation practices, yoga practices, and you just talked about hormonal changes. There are like innumerable neurons and, you know, all kinds of the nervous system, for example. How does this yoga practice work in terms of cutting down that particular disease?
Causal factors in the disease. So in terms of a lifestyle disease, it is those lifestyle behaviors that are aberrant. The inability to manage stress, for example. And most people don't recognize how much stress plays a role in virtually every disease state. It is probably the major risk factor for the development of depression. And what happens with chronic stress is that you have a flood and an ongoing high level of stress hormones and sympathetic nerve activity in your body. That is toxic. In fact, glucose regulation, which is dysfunctional in type 2 diabetes, is directly affected by stress management. And then there's the secondary factor. So first of all, stress has direct impacts on these functions. Second of all, stress has secondary impacts. So we talked about the negative reaction to stress by eating high carbohydrate foods, for example. That's not good for a type 2 diabetic. That's exacerbating the condition. So by reducing the stress, you take away that negative drive. And then by increasing the mind-body awareness, you actually get that person to experience the positive benefits of positive lifestyle behaviors like exercise and proper diet, and away from negative behaviors like smoking cigarettes and excessive alcohol consumption. So these are at the root of these lifestyle diseases. These are the thing about lifestyle diseases is that they are preventable. And because they're preventable, they're also reversible to a large degree. And in fact, cancer is considered a preventable disease. It's a little bit less reversible, obviously, but it is considered primarily a preventable disease.
I think those are the two key words here, preventable and reversible. And I'm not sure if a lot of people out there are aware of this, but that was a very powerful message today from this conversation, that if you adopt this lifestyle of yoga, whatever conditions you have can be preventable and reversible. That's really good to know. An organization like Brahma Kumaris, what role in your mind will it play on the society at large in bringing the peace and harmony that we're so much looking for?
I think that all of the yoga and meditation traditions are important. People want a variety. You know, people are buying one brand of car and not another brand of car, and I think it's the same with anything. You're attracted to a certain style of meditation, to a certain style of yoga. And so I think the variety, the access to these contemplative practices is important. We need to be working at the grassroots level. We need to be promoting this, offering this to the general public, as we have been doing. And it's paying off. We are seeing this grassroots growth in the prevalence of yoga and meditation practice in the general public. And so that's great. And I think Brahma Kumaris is one of the contemplative traditional styles of contemplative practice, and I think it's very important and plays a big role.
In terms of what you've observed or learned here, is there anything that you would take back with you and maybe add those practices or principles that you may have picked up here when you go back to your research?
Well, at this point, the principles are pretty much universal, and I see them in all the traditions, and all the contemplative traditions, and I see them here as well. My specific research is, when I do a specific trial, I'm doing a specific lineage, and that's usually where the grant money comes from as well. So that's limiting what I do in terms of the application of these practices. But I would say that virtually all of the contemplative and traditional yoga practice styles that I've seen have all of these principles in place. They're very common. And they're common because they're biology.
Right.
Because as humans, we have this same reaction to meditation practice. We all experience the same things physiologically, psychologically, and spiritually when we go through these spiritual practices.
In terms of your study on circadian rhythms or sleep cycles, could you talk about that a little bit, what you've seen in the correlation between yoga and sleeping patterns?
So yoga is very good for sleep, in fact. And if you talk to people who are beginner yoga practitioners and get them within the first few weeks of their practice, one of the anecdotes you hear very commonly is, my sleep got better. I'm sleeping deeper. I'm sleeping longer. My sleep is more satisfying. And there is a phenomenon and a disorder called insomnia, which is the most prevalent disorder of sleep. That's the inability to fall asleep or stay asleep. And what we know about that condition is that stress plays a large role. People who have chronic insomnia, their stress hormone levels are higher, their sympathetic activity is higher. It's like they're constantly on caffeine. It's what we call,
they're on the high.
Yeah, it's a hyperarousal. It's like you're stimulated and constantly stimulated. And it's that stimulation that keeps you from falling into a deeper sleep and having more satisfying sleep. And so yoga is a perfect fit for that, because what it does is it de-arouses. It reduces that hyperarousal and allows people to fall asleep. It allows people to stay asleep, to go into deeper sleep. And so that's what we did with yoga. We did it as a clinical trial of people who did have chronic insomnia. And one of the things you see is that it takes time. And that's the way these mind-body therapies work. In fact, they take time. It's taken you a month or a year to develop chronic insomnia. If you do these practices, it's going to take your body some time to rebalance and come back. What you're doing is really treating the underlying condition and the underlying factors that are contributing to the condition, as opposed to one of the most common allopathic approaches, which is sleeping pills. They do not really address the underlying cause of insomnia. They basically knock you out. And then, you fall asleep. And so people will there are anecdotes where people will take a sleeping pill for 10 years and they're sleeping fine. And then they stop taking the sleeping pill and their insomnia comes back to right where it was exactly from 10 years ago. And from the perspective of integrative medicine, I consider that a failure. And the reason it's a failure is because you have not solved the underlying condition.
That's true.
And modern medicine often doesn't really care, in many cases, about as long as they're treating the symptom and getting the symptom away, they're satisfied. But from integrative medicine, we're not satisfied because we still see an imbalance in the system. And unless you've really removed that imbalance and taken away the underlying cause, you haven't really addressed the disease in the way that you should be addressing it.
I guess that's the bottom line. You have to treat the person, not the disease. That's the bottom line.
That's correct. And so different people have different aspects. So two type 2 diabetics can have very, very different personalities and very different factors and weighted factors in terms of what is really dominating in their maintenance of the disease. And so knowing that will allow you to adjust your strategy a little bit more effectively. So a gross example might be that one person who's developed type 2 diabetes is entirely dietary. Their dietary choices are absolutely abysmal. And in another case, this person is completely incapable of managing stress, and it's just totally dominating his life. So two things that are causing the type 2 diabetes in this patient is very different between them. So you could then, in a personalized analysis, come to that finding and then focus your treatment to be more heavily addressing what you believe are the real causative factors.
We have a lot of viewers out there watching us today. Do you have any kind of inspirational message that you may want to give to our viewers?
Well, I would say practice is that message. And share the wealth. I mean, I think one of the moral duties of those of us who have experienced the benefits of yoga and meditation practice, I view it as a moral duty to share that. Okay. And that means becoming a teacher and a promoter to help this movement forward. Because we are at a crisis point. We're at a tipping point in a sense. This epidemic in chronic disease is really taking a lot of lives. It's causing a lot of pain. It's causing a lot of suffering. And I believe yoga has a lot to offer in terms of alleviating those diseases and that suffering.
Right.
And so that would be the message, is to teach and share and promote.
Very beautifully said. And with those words, we would like to conclude this program for lack of time. I wish we could continue this beautiful conversation, but we do have our time constraints. So I really thank you for coming to the studio and being with us, and for all the beautiful information you gave us. Om Shanti.
Om Shanti. Thank you very much.
We had this wonderful conversation with Dr. Khalsa on mind-body medicine and the role that yoga can play in therapy. I hope you found this conversation informative, and we look forward to seeing you again in our next episode of Ek Mulakat. Until then, take care. Om Shanti.